welcome everybody to tonight's NANN Connection. It's our 6th NANN Connection, and my name is Kelly Thompson, and I'm a neonatal nurse practitioner at Community Hospital in Munster, Indiana. And I got my undergrad from Purdue University in West Lafayette, go Boilers, and I got my master's degree at Rush University in Chicago, Illinois. I'm the chair of NANN's membership committee, who is hosting tonight's event. I want to thank all my colleagues on the membership committee and the NANN staff members, Molly and Olivia, who helped make this event come forth and make these events possible. NANN Connections were born from feedback we had received from NANN members and the 2020 annual conference attendees who needed and wanted more opportunities to connect with their neonatal peers from around the world. Tonight's event is for our nursing students who are interested in the neonatal nursing career. This is your opportunity to learn and ask questions. NANN will continue to host similar events free to all neonatal nurses throughout 2022. If you would like to view any of our previous NANN Connections, please go over to NANN's website and search NANN Connections, and you will be able to view all of the NANN Connections from 2021. This is a very special NANN Connection event because we have been looking ways to connect with and interact with our nursing students, just like you. We are thrilled to welcome so many of you to today's meeting and share your experiences in the NICU and in their profession, answer your questions, and hopefully help you make the transition to the NICU a smooth one. Before we get started, we want to hear from you via our Zoom polling system. When prompted on the screen, please share with us the information about where you are in your nursing education to help us get an idea of who is here with us tonight. If you don't see the prompt, feel free to write your response in the chat box. So if you're not seeing the poll, it should say you can respond in the live chat, but what year nursing school are you currently in?
Yeah, sorry, our poll is not working right now. I did have it up earlier, but yeah, sorry. We can just comment in the text box. Sorry about that.
So it looks like we have a good mixture, 2nd, 3rd, senior year. I don't see it. Oh, I see a 1st year. So we got a pretty good amount of different from anywhere from 1st year to senior year of nursing. Okay, so the next chat question we're going to have you guys fill out in the chat box is, with tonight's topic being everything students need to know about neonatal nursing, what are you most interested in learning more about tonight? So feel free to write that in the chat box. So what a typical day looks like, NICU meds, how to start as a new grad, how to get involved in the NICU, what hiring managers are looking for a new grad advice, new grad opportunities.
Kelly, I saw, how do I know if it's the right fit for me? I thought that was a interesting one.
As a new grad, what are the steps, recommendations for getting into a NICU position? What experience to get prior to applying? How to be successful as a new grad in the NICU? Did you go directly into NICU or did you start on the regular floor? Okay, so we've got some information that hopefully we'll be able to answer some of these questions. Also, journey to becoming an NP. So hopefully we will hit all these answers. A little bit about myself. I went to Purdue University, went straight into NICU nursing. I was a tech on a NICU floor at the local hospital I was at. And so when I graduated, they asked me to work in the NICU. Then a few years later, I decided I wanted to be an NP. So I went to Rush and stayed with the same hospital system but I have moved on to a different hospital system. So it's great to get involved into the NICU right away if that's something you want to do. See if you can volunteer, be a cuddler, see if you can be a nurse tech or a nursing assistant, they call them. So nursing fellow. So it's great to get involved into NICU even while you're still in nursing school, if that's a possibility. Okay, so just by joining us tonight, I wanted to let you guys all know that you guys are entered into a giveaway for a $50 gift card to Spa Finder and also a 1-year student membership for NANN for free. So you need to stay tuned to the wrap up of tonight's session to find out if you've won. You must be on the call at the end of the night to be the winner. So I've talked a little bit about myself. Now I'm going to take a little time and introduce the rest of our panel that's here tonight. It's my honor to introduce our first panelist, Gail Bagwell. She is NANN's current president. So Gail, thank you so much for joining us tonight. Can you please introduce yourself to the group?
Yes, thank you, Kelly. My name, as Kelly said, I'm Gail Bagwell. I'm the president of NANN, and I'm also a clinical nurse specialist that works at Nationwide Children's Hospital in Columbus, Ohio. And I do outreach for our large neonatal services network, about a 35 county area where I go and work with the, all the hospitals that send babies to us. So.
Thank you, Gail. Okay, Tasha, can you talk a little bit about yourself?
Sure. Good afternoon. I'm Tasha Harris. I am a neonatal nurse practitioner. I've just recently transitioned from being full-time to doing some locum work across the country. I am also the current editor of the NANN E-News newsletter, and I am a member of NANN's NANN Council.
Okay, Jennifer, can you introduce yourself?
Hi, everyone. My name is Jennifer Fries. I am one of the staff nurse directors at large for NANN, and I am also a staff nurse at Lucille Packard Children's Hospital at Stanford.
Thank you. Deanna, can you go next?
Hi, everyone. My name is Deanna Hill. I'm actually the clinical education specialist at Connecticut Children's in Hartford, Connecticut, and I'm also the current serving president of the New England chapter of NANN. Great to be here tonight.
Thank you. And Maggie?
Hi, everyone. My name is Maggie. I am a clinical transport nurse at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire. It's a level 3 NICU.
Okay, just so you guys are aware, just a quick note, for best experience, switch your view to a speaker view via the 3 dots in the upper right-hand corner of your screen, and feel free to unmute yourself during the conversation to take part in any of the discussion. You can use the raise your hand feature to be sure we don't miss your insights, contributions, or questions. We want to hear from you guys. So now let's start and learn about the different experiences from our panelists. So first, we're going to start with Gail.
Thank you, Kelly. So my journey into being a neonatal intensive care nurse actually started when I was a student nurse at the University of Akron in Akron, Ohio. And we did our pediatric rotation at Akron Children's Hospital, and we got to tour the NICU, and the neonatologist actually came and spoke to us as student nurses, and that piqued my interest. And so when it became time to start looking for jobs, I applied at different hospitals and got my first job as a NICU nurse at University of Virginia NICU in Charlottesville, Virginia. I wanted to get away from Ohio winters. So it was a great experience. I spent almost 5 years there, got burned out. I will be honest with you, a lot of several babies I was very close with families died, and I needed a break. So I came back home to Ohio and did some emergency room nursing, which told me very quickly that I was not an emergency room nurse, but that I was a NICU nurse. And that's when I went back for my master's degree at University of Cincinnati to be a clinical nurse specialist, and then worked at several hospitals, University of Cincinnati, moved to Wisconsin for a short while with my fiance, who then became my husband, and then back to Ohio, and has been a clinical nurse specialist for many years now at Nationwide Children's Hospital, first in the NICU, and then doing outreach for the last several years. So it's a journey that has been a exciting journey, but it's also one that, you know, somebody had said earlier, how do I know if it's a right fit? I don't think you really know it's a right fit until you try it. For some people will come in and they absolutely love it and they never leave. And there's others like me that come in and we love it, but we need a break. And I think that's one of the best advice that a nurse, more experienced nurse, gave me at UVA when I was getting burned out. She said, I wish I would have gone and tried something else. But now it's too late for me. She had been doing it for 30 years at that point. And I did it and very quickly realized that I was a NICU nurse at heart and came back to it and never regretted 1 minute of it. I love my babies. I love the families. When you go into NICU nursing, it's not just taking care of babies, it's taking care of the mothers and the fathers and the extended families as well. It's the whole package. So you need to be able to love teaching as well as taking care of sick babies. So what questions does anybody have? If any. I think somebody had said, how do you get hired into a NICU? Megan, yes, I see that you said you heard it's a bad idea to go straight into NICU as opposed to gaining experience. I don't think it was a bad idea. It depends on the units. Some units will take you straight out of school, nursing school. Other units want you to have an experience before you come into the NICU. I think the other panelists can speak on that as well. I went straight from nursing school to a NICU and did perfectly fine. You have to make sure that they have a good orientation program for you because you do not learn NICU nursing in undergrad school. And so you need to go somewhere where they're going to give you a lot of good support. And I think one thing that can help you get hired into NICUs is what Kelly said earlier about, volunteering in a NICU, doing your senior rotation in the NICU, your professional development course when you're your senior year in a NICU. Also joining your national organization, it shows them that you're invested in neonatal nursing. Were there other questions? I saw some things fly by.
Gail, it says, what strategies did you use to cope with difficult parts of NICU nursing?
What I do now is I've learned that I have to take care of myself, and I love to walk, and I did have a dog who recently passed, but you just find things that you love to do outside of nursing to help you cope with those bad days. And you have to have somebody that you can sometimes, ventilate to. And usually you make good friends in the NICU. I know I have lifelong friends. And, sometimes you just need to vent to them. And I took a break when it got really bad. I just had to say I need to leave NICU nursing for a while and then came back to it within a couple of years.
Okay, Gail, we have a question. What do you do as a clinical nurse specialist in the NICU?
So when I was in the NICU, I was responsible for staff education, and I followed the complicated kids. So, we have neonatal nurse practitioners, but the case manager, we also functioned as the clinical nurse specialist, functioned as a case manager. So really working with the parents one-on-one, with the more complex, difficult patients, helping them get things that they need to take that baby home, doing follow-up with the parents once the babies went home. Now my role as a clinical nurse specialist is dealing with our referral hospitals. So we have like 35 different counties and probably about 20 some odd hospitals in those 35 counties that refer babies to our large neonatal services network units. And I work with all those delivery hospitals, level 1s, level 2s, to how to make sure the staff are prepared to take care of sick and premature babies prior to them being transferred to our facility. I also work with them just how to take care of a healthy, well-term newborn, which is really important because you got to know what a well-term newborn looks like in order to know when there's a sick baby. And then I also do consulting with the managers and the educators on topics that they need help with. When hospitals want to raise their level of care, I go out and do consultation to help them determine what it's going to take to increase from a level 1 to a level 2 or a level 2 to a level 3 NICU. A lot of consulting and QI work now. We're actually starting QI projects with our regional hospitals.
Thank you, Gail.
You're
We are
welcome.
going to move on to Tasha. And then, like I said, we are going to try to get through all the questions. We might direct some of your questions that you're posting in the chat box to maybe people that we feel will fit better with answering the questions. So keep putting your questions in the chat box. And next, Tasha is going to talk to you guys.
All right, so I did not originally start off with the plan of becoming a NICU nurse. And throughout my entire nursing school career, I had the mindset that I would actually be a labor and delivery nurse. But on the last day of nursing clinicals, my last year, we had the option of just visiting different areas in the hospital, and I decided to visit the NICU. And the minute I walked through the door, I knew that was where I needed to be. So after graduation, I was very fortunate enough to get hired into a very busy level 3 high acuity NICU. I stayed there for almost 13 years, during which time I went back to school and got my master's, moved here to Tennessee, was very fortunate enough to get, again, hired on as a new grad in a very high acuity level 4 NICU. And I stayed here for 5 years, during which time I got my doctorate. I then transitioned over to a level 3 delivery service. At that time, I was only one of 2 practitioners on that service. And also that service had never had practitioners before. So it was a big change in environment, walking into a unit that had never utilized nurse practitioners before. So making not only the nurses kind of aware of what we did, but also hospital administration. They weren't quite sure, what we were able to do. So that was a big change. Again, since then, I have now transitioned to just doing locum work, traveling across the country to level 3, level 4 NICUs, and working in that environment. I can say that being a NICU nurse has been one of the greatest joys of my life. It is very emotionally taxing, but at the same time, it's also very professionally fulfilling, because I know at the end of the day, that I have given my babies and their families the best care that I could have possibly have given. And that makes me feel good. It makes me feel good not only as a person, but also as a nurse. So if you are considering seriously considering a career in NICU nursing, I would just say, just be prepared, because it's going to be a roller coaster at first. There's a lot of adjustments that you'll make, that you'll need to make, both, again, on a professional and a personal level. But with time, a lot of education, a lot of perseverance, you will do fine. And again, it's very rewarding. I have not regretted a day that I have made the decision to become a NICU nurse. I think you may be.
Thank you, Tasha. So one of the questions we have is, what's the process for becoming an NNP, and what do you do as an NNP?
So very quickly, the process is, once you finish nursing school, of course, you go to work in the NICU. Ideally, I am kind of on the side of getting as much experience as you can as a bedside nurse, because you will build on that experience and that knowledge as you become a nurse practitioner. You decide whatever master's program or doctorate program that you want to attend. Look at the requirements that they are asking for. There's core classes that you have to take before you actually begin your concentrated NNP classes. Usually, depending on what type of program you go to, my master's program was 2 years. But because I already had my master's when I went into the doctorate program, my doctorate program was only 2 years. Usually, if you're going from RN to DNP or PhD, that's another track that you can go into. It's usually about 4 years, a very intense 4 years. So you have to kind of be in that mindset that this is what I really want, because it takes dedication to complete, especially if you have to work and go to school. You have to be in that mindset that you really want this, because it's going to test every bit of perseverance that you have. And as far as what I do as an NNP, I clinically manage a group of babies throughout the day. Usually it can be anywhere, depending on where I am working, it can be anywhere from 12 to 15 babies to an entire unit if I'm covering the night shift, which is mostly what I do. I do everything from managing ventilator settings to calculating IV fluids, prescribing narcotics. Also, I spend time talking to families, talking to moms, dads, encouraging them, as Gail said, because you treat not only the baby that's in the bed, you treat their tribe, their family. And so it's important to try your best to make a connection with those parents, with that family, and teach them as well, because they're scared. They're not anticipating usually to be in this position, and they need that care just as much as their baby does. I also attend deliveries, high-risk deliveries, some that we sometimes know about, some that we don't. But I do that as well, stabilize the baby, and whether it comes to NICU or to the newborn nursery, kind of depends on how that process goes. If the baby comes to us, to the NICU, again, if the baby's ventilated, I manage the vent, I intubate, put in umbilical lines, start IVs. There's procedures and there are other procedures that I do as well. So it's kind of a catch-all kind of job. I am the doctor's stand-in when they are not there. So it's a lot of responsibility, and I take it very seriously.
Thank you, Tasha. Okay, so we are going to move on. We're going to go next with Jennifer. So Jennifer, if you could talk a little bit more about what you do, and we'll get some questions for you.
Hi, everyone. My name is Jennifer. I've been a NICU nurse for 9 years now. And as I said, I'm one of the staff nurse directors at large for NANN. And it's been quite a journey for me, as I'm sure it has been for everyone else here. I actually started with my associate's degree in nursing and worked as a NICU nurse for about 5 or 6 years before I went on to get my bachelor's. And I'm in school right now for my master's degree towards becoming an NNP. So it's been a process for me. And I totally agree with what Tasha just said, as far as having that bedside experience before moving into an advanced practice role. If I didn't have that, I'm not in that role yet, but if I didn't have the experience that I have, I wouldn't be able to comprehend some of the things that are coming at me in school. So I think that's a great piece of advice. Of course, it's different for everyone, but it's definitely helped me so far in my current education program. I'm really passionate about professional development and continuing education. And for me, it's about balance. I've had to learn how to go for the next thing, pursue the next opportunity, but also be content where I am, which is not easy for me because I'm always wanting to reach my next goal. And sometimes I have to take a moment, take a break, and be happy where I am, and also worry about my own well-being and health as well. And constantly striving for the next thing isn't always the best. Let's see, professionally, I have been on the NCLEX item review panel 3 times. So I'm part of the development of the NCLEX questions, which is a lot of fun. I enjoy doing that. And I also write and review questions for the neonatal specialty certification exam. And I like that even more because that's what I know about. A lot of times with the NCLEX review, it's questions about adults, which is far from my mind at this point. But writing questions and reviewing the content for the neonatal certification exam is a lot of fun. I really enjoy that. Let's see, additionally, I am an NRP instructor. I love teaching. I love working with newer nurses and helping them seek opportunities and helping them seek growth. So that is a little bit about me.
Kelly, you're on mute.
Sorry, guys. Okay, sorry, Jennifer. I'm going to go with one of the questions I was asked earlier, but what do you do? What's some of your daily jobs as a NICU nurse?
That's a great question. So as a NICU nurse daily, it's my job to be at the patient's bedside performing all of the assessments. Our advanced practice providers, whether it be nurse practitioners or physicians or PAs or whatever the case may be, they don't spend that much time at the bedside of the baby because, as Tasha mentioned, she may be watching an entire unit. As the bedside nurse, it's my job to maintain the baby's stability and to let the provider know if something's not right. So in a given day, I may do 2 assessments, I may do 16 assessments, but it really doesn't matter on the official number that I've documented. I'm in a constant state of assessment, right? I'm constantly watching my baby. I'm constantly watching that monitor, noticing the tiniest changes because my patient can't tell me that they're in pain. My patient can't tell me that something's going wrong. So I have to be able to discern that and discern when it's something like I'm uncomfortable because I have a dirty diaper, or I'm hurting because I have a perforated intestine. And to be able to do those assessments and to notify providers when I think intervention is needed so that we can work collaboratively as a team for the best interest of the baby. So it's assessing, making the appropriate interventions and elevating concerns, I would say, is my primary role as a bedside nurse.
Okay, another question we have is what's the typical nurse to patient ratio in the NICU?
It varies so much. So that's an area that I think could use improvement. And I recently moved, and on the East Coast where I worked before, sometimes you would have 1 patient, but that was very, very rare. I've had up to 6 patients, which I would not recommend. Here where I am now, it's 1 to 2 patients typically, but it varies per facility and it varies per circumstance. Even the best facility can't always predict that they're going to have 6 call outs in one night. So it really varies a lot. Most NICUs for ICU level patients, it's probably around 2 to 3 patients. For patients that are more of an intermediate or step down level of care, it can be a higher number, more like 3 to 4 patients.
Okay, and then last question for you. What was the biggest fear working as a new grad in the NICU?
I saw when that question popped up earlier, and I didn't see who answered it, but it was my answer as well. And it's still my biggest fear today. What if I mess up? What if I miss something? What if I don't interpret that vital sign? And something goes on later and escalates when I could have stopped it. I think that's my biggest fear. What if I miss something? And anytime I have an outcome that isn't the way I wanted, I ask myself that again. And I think any good nurse does. Did we miss something? Could I have done something better? So that's my biggest fear.
Okay, thank you so much. Okay, we're going to move on to Deanna.
Hi, everyone. Again, Deanna Hill, and I am the clinical education specialist at Connecticut Children's. And I actually started off following the path that you've probably all been told. Going into med-surg was where I started. I graduated from the University of Rhode Island, and I worked in downtown Philadelphia on a med-surg unit for several years. Getting that under my belt and really feeling comfortable with it. It was great because I had the opportunity to work with a spinal cord injury population as well as an ENT population where I had a lot of experience with trachs and laryngectomies. I then moved on to a surgical intensive care unit in downtown Philadelphia and saw a lot of just about everything that was on the television, whether it was the shootings or whatever it could possibly be, is what we saw in the surgical ICU. It was very technical, and we were taking care of a lot of machines. So as I moved to Connecticut and to follow my soon-to-be husband, I was looking for something that allowed me to connect with people in a different way, because as I worked in this adult ICU, and there were some visitors that came in. I just didn't have that connection, that connectedness. And that was something I was really looking for. So I decided to try on a whim the neonatal ICU, and I just fell in love with it. And I've been there for 25 years now. I am in a clinical education specialist role. So I am the person that onboards and orients all of the new nurses that come into the NICU. I work in a level 4 unit in Hartford, Connecticut. And one thing that we may not have explained is there are various levels. So there's a level 4, 3, 2, 1. And each one of those, the level 4 is the highest acuity. They take care of patients that require ECMO. They have transport services. They also are getting complex surgical and genetic disordered patients. So lots of times they're the centers that you send patients to from some of the other levels. So in that type of setting, I actually got to experience being a transport nurse, which I'm going to let Maggie speak a little bit more about, but we did go out in the ambulance and pick up patients from other hospitals as a bedside nurse. And that was super exciting. It was just another opportunity to grow. I also went on some medical mission trips as a NICU nurse as well, which was pretty fantastic to go across the globe and be able to explore and take care of patients in other parts of the world, underserved communities. And it was just a great way to grow. And finally, I ended up in this role that really allowed me to participate in a lot of quality improvement work and research. I'm the primary investigator for a couple big research projects right now, and numerous quality improvement projects with the nurses that are in our unit. We work together collaboratively, and we also work with families, which is really fun. We have families on our quality improvement projects. Many of the people that are on the panel participate in big quality improvement collaboratives that are across the world. And so you get the opportunity to network with people from all over the globe to improve care for babies and their families. So it's pretty awesome. I'm also—
Deanna, can I ask you a question?
Sure.
Okay, so we have a question from someone that wants to know what can we do as nursing students if we're not able to get a practicum experience in the NICU due to COVID or limitation placements? Or what can we do as an alternative just in case?
So that's a great question. So I would say any experience that you can get. So one of the things that I'm looking at resumes, I have 65 capstone resumes. That I saw that there were a lot of people from the Connecticut area on this Zoom right now. And I have 65 capstone applicants right now that I have to make a decision on to bring to interview. And it's so hard because everybody looks great on paper, and it's really hard to make those kind of choices. But the things that are going to really set you apart are any kind of experience. If you've been working in a hospital in an acute care environment, you're used to working at that kind of pace. That's something very specific I look for in a resume, that you've been out in the hospital setting. It's fast paced. You have to be working, you're kind of used to that environment. So that's one thing I really look for. So PCA type of position, something like that is really helpful. Even if you've worked in a restaurant where you've had to do a lot of customer service, fast thinking, where you have to interact with and communicate with people who might not be happy, that's another opportunity that you could explore as well. But I would say try to get into any hospital environment, number one. And again, be a part of your professional. If I see that there's somebody that's already invested in an organization like NANN, that's something that stands out. Like, this person actually really wants to be in neonatal nursing, whether it's now or in the future. And the one other thing I will say is don't get disappointed. Again, I'm looking at 65 capstone applicants, and it's so hard to make that decision. And I don't want it to be a reflection or bursting anyone's joy because they didn't get in. It really is a difficult thing to do. So I just say, just put your boots back on and get back to it and try it again. So it's kind of hit or miss at this particular point.
Thank you, Deanna. Okay, so we are going to move on to Maggie.
Hi. So again, my name is Maggie. I am a clinical transport nurse at Dartmouth Hitchcock in Lebanon, New Hampshire. I graduated from nursing school in 2017, so I've only really been a nurse for 4 years. So I did want to take some time to really talk about what it's like to be a student nurse and a new grad. I did have the opportunity to complete my preceptorship in a NICU. I kind of just wanted to see what it was about. And it was really exciting, but super intimidating. NICU nurses are really protective of their patients. So you kind of have to, you know, get yourself in the groove. And one way that I like to do that is by learning where everything is on a unit. So when you're not able to help do procedures or something, you can make yourself useful by going to get supplies and then having a spot in the room so that you can learn what's going on. And then people know that they can go to you, even as a student, to help them. So that was something that was helpful. It's also kind of like a job interview, because when it came time to apply for the new grad position at this hospital, they already knew me. They knew I was willing to work hard and be a curious learner. So I did start as a new grad in the NICU, and I have absolutely zero regrets about it. I got plenty of adult experience in clinical rotations, but NICU nursing really touched my heart. That doesn't mean it was an easy transition into being a new grad nurse. It's really hard and it's really stressful. I can't tell you how many stress dreams I had every day before going into work. And one of the best things that I ever did for myself was actually just going to therapy and learning some really good coping skills so that I didn't get burnt out. So at my first hospital, I worked there for about 2 years. And then I decided that I needed to grow myself as a nurse. So then I ended up coming to Dartmouth, where I've been for the last 2 years. And I've had some really great opportunities. I have been in an ethics fellowship for the last year. So I've been sitting on the clinical ethics committee at my hospital, and I've also been working on a literature review, which fingers crossed will be done soon. But this is where the great thing about being a part of a professional organization comes into play, because I knew I really needed a NICU mentor. And I actually met Deanna through a NANN event and reached out to her through the NANN mentor program to kind of help me. She's been invaluable, critiquing presentations, getting me connections to people I would have never met without her. And even just being here tonight, she's always thinking about ways that she can grow me as a professional nurse. So no matter what avenue you go into nursing, find yourself a mentor, especially through NANN, because even if you don't have a specific goal, they can help you where you're at. The other great opportunity I got in the last year, I was asked to apply to be a clinical transport nurse. What's special about our team specifically is that we're a 2-person transport team. So it's just a nurse and respiratory therapist going to outside hospitals, stabilizing patients, and then transporting them back, as Deanna said, either an ambulance or helicopter. This has been really special for me because I have no interest in being an NNP. It's not the responsibility I want, but I get to practice at the highest extent that my nursing license will allow. And it's really empowering to be a bedside nurse and being able to do that. So, and I literally just got off orientation 3 days ago. So that's kind of my trajectory.
Thank you. Okay, we have a question from earlier. Let me pull it up. With cluster care for babies in the NICU, what is done as a nurse during your shift time where you are not providing direct patient care?
Mm-hmm. So much. You're helping your coworkers with procedures they may be doing. You're educating yourselves. You're teaching parents because they're learning how to be parents in this new environment that they weren't expecting. You're also just doing a lot of watching and waiting. If I don't have anything to do, I'm constantly looking at my baby in the monitor. And as Jennifer said, just noticing the little signs. There's not a lot of downtime, honestly, even though, you may only touch your baby 4 times in a shift.
Thank you. Okay, so there was a question that someone asked, but I'm going to ask it to the panel if each of you guys will take a turn answering it. But what's your favorite part of your job? So we'll start with Gail.
The favorite part of my job, my current job, is working with nurses and teaching them how to take care of sick and premature babies. They want to learn out in the region. They really do. The nurses in our community hospitals, they really want to learn.
Tasha?
My favorite part is learning. Every day that I go to work, even though I've been doing this for a very long time now, even though I have the degrees that I have, there is not a day that goes by that I do not walk into the NICU and I learn something, whether it be from my fellow NNPs, from the bedside nurse, from the NEO. I soak up every bit of knowledge that I can. Also, taking care of those babies, going to those deliveries, welcoming those babies into the world.
Thanks, Tasha. Jennifer?
My favorite part of my job is helping parents hold their baby for the first time, especially if it's a teeny tiny, fragile, scary baby and they're terrified, especially dads. That's the best. There's just something so special about a dad holding his baby. I love it. That's my very favorite thing.
Deanna?
I think it, for me, again, connectedness either amongst your teammates, because I feel like the NICU has something really special as a team. It's even just the people in this group today, it feels like a family. And so it's not just connectedness with your patients and families, but also as a team. And I will just mention one other thing. They never forget you. You can be anywhere. You could be in a grocery store 400 miles away from home, and somebody will recognize you and come up to you and say, you took care of my baby. And it's the coming together of this moment of birth with kind of a fairly traumatic moment as well. Not many people want to be in the NICU with their child. So it's so impactful for these families. You have so much power to make a positive impact. And that is really a gift to each one of us. Each one of us gets that gift. And it's a pretty beautiful place to work.
Maggie?
I wholeheartedly agree with Jennifer. I was going to say that, but also I would say being a patient advocate and a parent advocate as well, like you are really a trusted person to parents because you're spending the most amount of time with them, and being able to help them navigate through this like traumatic experience is really special.
Okay, now we can open it up. If anybody has any more questions, feel free to put it in the chat box, or you can unmute yourself and ask a questions. We have about 8 minutes left before we start wrapping up tonight's discussion.
Kelly, Cassie Brown asked about unit cultures. Does everyone support each other? What's the culture like? And it is, to me, depends on the NICU you go into. The culture that I went into at UVA was different than the one at University of Cincinnati versus Milwaukee Children's back to Nationwide Children's. So it is very specific to, I think, the part of the country you're in. But a lot of them are very family oriented, as Deanna said, you're like a big family there. And some are very welcoming and some maybe might not be as welcoming. I don't know what the rest of the panelists feel like.
Does anybody else have anything they'd like to add?
I would just say that sometimes when you encounter people in your unit that don't seem welcoming, it could just be that they're not welcoming, or it can also be that they are very protective of their patients, as one of the other panelists mentioned. And we want the best for them, absolutely. And we want the best for you. If we see that you have potential and there's a situation you can learn from, a preceptor or an experienced nurse around you might ask you a lot of questions. You may feel like you're put on the spot, but that doesn't necessarily mean that they're trying not to welcome you. So a tiny bit, you need a bit of a thick skin, but also you shouldn't tolerate bullying. So it's a fine line to walk to know when you're being challenged professionally in a good way and when it's gone too far. So I just want to encourage you to consider that, as well as, this person challenging me to grow, or are they belittling me? And hopefully most of our environments are a professional growth type of environment.
Thanks, Jennifer. Okay, I'm going to go on to this next question. I was wondering if it's extremely important to have experience as a tech or CNA just in nursing in general, not even just in NICU. I plan on doing an externship before my senior year, but besides that and clinicals and studying abroad, haven't had any direct in-hospital experience. I'm worried I may not get an externship after hearing people look for different experiences.
I don't think it's necessary, but I think being a CNA or an LNA before you're a nurse kind of gives you an appreciation for what other people do on the floor, and just gets you used to the environment.
From my experience, I started off as it was like called a nurse tech, and I did med surg and ER in nursing school. And then my last semester, I was able to get into the NICU and do my nurse tech there. So it was good, getting kind of a little, taste of what everything was before, but I kind of always knew I wanted to do NICU. So getting in as that nurse tech, and probably the only reason I was able to get that position was because I had worked for the hospital, and they knew that was a passion I wanted to pursue at some point in time. So as soon as that opened up, the hospital recruiter had reached out to me to see if I was interested in it. So even if you can't get into NICU, let them know that's something you're interested in. And I know we have nurse fellows come into our unit and follow a nurse for a day and stuff like that.
Ellie, it looks like Jenna has her hand raised. I don't know if
I can't see any hand raised. So okay. Jana, if you have a question, feel free to unmute yourself.
Sorry, my lighting's kind of bad. I'm sitting in my car. I just wanted to introduce myself. My name is Jenna, and I'm a neonatal nurse practitioner. I've been a nurse practitioner for 3 years, and I kind of wanted to touch on this question about experience. I don't think CNA experience is necessary. I know in the environment we're in now with COVID, I know it's difficult sometimes to get in, but I feel like anything that you can do in the hospital to get yourself in the environment of a hospital is helpful. Think outside the box, be a secretary, be a volunteer, anything or be a transport person. There's always needs for patient transporters. So just getting yourself in the door into a hospital, I think that's key. The other thing is, I know someone else has already mentioned it, but going ahead and taking the initiative of joining an organization like NANN. If you look into it, there are student rates, and the student rates are very affordable. And I think that the knowledge and the community and the support that you would get from joining an organization like NANN is extremely valuable. So I would encourage you guys to look into that. Thanks.
Thanks, Jana. It looks like we'll try to get one more question. So does anybody have any advice for someone who's trying to get their dream job as a NICU nurse? What's something besides maybe volunteering or something like that they could try to do to become a NICU nurse?
I would just mention that you should just try to get yourself out there. LinkedIn, one of the nurses that we recently hired had reached out to several people in our unit on LinkedIn, and was kind of persistent with it. I actually wasn't going to even look at the resume, and just because she was a little bit persistent with it, I decided to take a peek. And we actually do hire new grads in our unit, and we do have a residency program, and we provide a longer orientation for our nurses that are new grads. So I would just explore hospitals that have residency programs that you're going to get support for sure. If you're going to go straight out of school into NICU nursing, make sure you go to a hospital that you will have some of that support in place.
And I was just gonna,
yep.
Oh, sorry. I was just gonna touch on something that Deanna mentioned. Be persistent. Sometimes you will not always get that call back on your first application. Maybe look into applying for a newborn nursery position. At least maybe that will get you, you know, some experience. Again, I was very fortunate enough to get hired into the NICU right out of school, but I know that is not always the case for everyone. But as she said, do whatever you can to get yourself out there. Make friends with as many NICU nurses as you know, NICU managers, and just like I said, just be visible and just let people know that, hey, I'm interested. If you're hiring, I'm interested. Also look at the whatever facility you're looking at, or at any facility, and see what positions they have open. I'm not quite sure how nurse internships and things like that are advertised, or if they even are, but try to make connections on that route, and see what you can do. But again, just be persistent and don't give up.
Thank you, Tasha. So we didn't get to all the questions, but hopefully we'll be able to answer some of those questions in a later email and get them out to you. So that way all your questions from tonight will get answered. I want to thank everybody so much. Thank you for participating in tonight's discussion. We hope that it helped you all get a better insight of the neonatal world and what all is possible. For those of you who are just beginning your career in the NICU, there's a great resources on the NANN website via our NICU Knowledge Shares video series, which is free to all. You'll find all sorts of interesting topics that can help early career neonatal nurses, from surviving your first year in the NICU to climbing the clinical ladder, and so much more. Also, if you've not already joined NANN as a student nurse, now is the time. Not only will you receive our scholarly journal 6 times a year, but you will get discounts on our national convention, free educational tools, position statements and guidelines, and so much more. Just visit nann.org/join if you haven't already, to join the most vibrant and impactful community of the neonatal nurses and APRNs. We would love to welcome you guys. Before we go, we wanted to let you know that we will be following up with a quick survey to get your insights on tonight's events, as well as to find out what topics you'd like us to consider for future events. Please take a moment to answer that survey that will be sent to you in a follow-up email. And finally, be on the lookout for NANN Connections 2022. We're planning on hosting a student connection in early 2022. So look for more details to come in various NANN Connections. And remember, these events are free, not just for NANN members, but for our entire neonatal nursing community. Please encourage your peers to attend and connect with us for free. Thanks so much for joining us today. And finally, let's announce the winner of our $50 Spa Finder gift card and a 1-year NANN student membership. Today, our winner is Zeta Hussein. Zeta, are you here tonight?
Yes, I'm here.
Congratulations.
Thank you.
You have won a gift card and a membership.
Nice. Thank you.
So I want to thank everybody on our panel, the members from the panel for sharing their stories, and each of you for joining us tonight and for taking the time out of your busy schedule. We hope to see you guys again soon. Bye.